Welcome in, everyone. Thank you so much for joining us today. My name is Kiana Hatfield, and I am the Program Director here at the Parkinson Association of the Carolinas. And I'd like to say happy Parkinson Awareness Month to you all, and welcome to the second webinar of the month for our webinar series. And today's topic we have building a proper care team, and our speaker today is Katherine Sherry, and she is a licensed clinical social worker at Atrium Health Neuroscience Institute. Just a couple housekeeping things before we turn it over here. So we will have a Q&A session at the end. So if you have any questions, feel free to use the Q&A box or the chat box function as a parking lot for all of your questions, and we will answer those during the Q&A at the end. And then also today's session is being recorded and will be available later. So just be on the lookout for that when that is available. But without further ado, I would like to pass it over to Katherine here, and thank you all so much for being here.
Thank you. So I'm Katherine. I might have met some of you, not quite sure who's on, but I am a social worker with Atrium Health with the Neurosciences Institute. Actually, we have a kind of a newer name. It's the Atrium Health Neurology Specialty Care. So I work with the team with Dr. Englert and Dr. Fleming. I have been a social worker for more than 1 decade. I'm originally from the Northeast, and I went to undergrad at University of Maryland and did my graduate work in New York City, and kind of fell in love with movement disorders. I don't know, maybe 8 or 9 years ago. So that's I've been working with either Parkinson's or some other movement disorders like Huntington's disease since I think about 2012. So I don't know everything, but I know a little bit about movement disorders. Um, so that's a little bit about me. Just wanted to kind of go over today the who, the what, the where, when, and how of building a care team. And this can apply to, many other movement disorders or chronic illnesses, but specifically, obviously today, talking about Parkinson's. So let me just get situated here with my slides. All right, so just talking very briefly, and some of this is pretty intuitive, or might be, but asking yourself, what is a care team? The way I look at it is it's a number of practitioners that are going to be focusing on one diagnosis in their own silo of expertise. But I guess for me, one of the important factors here is that there's communication between some of these practitioners. So part of the building that care team is having folks that can somehow get information to each other, whether it's through a shared chart like on Epic, or for some clinics, there are a multidisciplinary team that can talk back and forth with all the practitioners involved in patient care. I guess I do have some notes and I'm a little bit nervous, so I am going to review my notes at times, so I apologize for looking down, but I guess for me, just to think about each discipline, they have their specialty. So we want them to help with a specific aspect of the disease. You want the doctor to obviously be the main player, but a neurologist doesn't know everything there is to know about physical therapy. So we want to make sure we have those folks involved. Another disclaimer I wanted just to put out there is that if you've seen one case of Parkinson's, you've seen one case. And that just means, I'm sure we've heard it before, that everybody has their own course and different manifestations of symptoms. So when we talk about having all of these practitioners and players being part of our care, what one patient might need is not going to look like another patient. So some people might not need all of these that I'm going to talk about today. Other people might utilize all of them, if not more. The list that I have come up with today is not exhaustive by any means, but these are usually the core elements. So, and the slide I have up now, couldn't find the perfect one, but this is a pretty good representation of just some of the players that we'll talk about today in just a minute. Want to note at the very center, though, as always, is I think the effort in medicine today has been moving towards patient-centered, we hope. So the idea of having the patient and their family or care partners be at the center of the care team. We can't leave the patient and the care partner out of this discussion either. Okay, moving on. I touched on this a little tiny bit, but the why of a care team, like why would you seek out someone beyond the main provider, which would, in our case, we're talking usually about a neurologist. So I put this cartoon just to break up the slides of words. But the idea of, like I said earlier, each member of your care team that you craft or are referred to are going to have a specialization that can really drill down and figure out exactly what symptom you're experiencing or what challenge or what problem, and really, hopefully, design a plan of care that meets your needs and your lifestyle and your circumstances and your insurance and all of those things. So we can't have one single practitioner that's an expert in all of our needs in Parkinson's. Okay. So who is part of a care team? This is kind of getting down to the brass tacks of like what is part of the proper care team. And I'll break down a little further in the next couple of slides, each one of these. So neurologist, primary care, social worker, which is, spoiler alert, I will probably have the most to say about because that's me. PT, OT, speech, psychiatry, and then I threw in there an estate planner, an attorney. Again, not all of these are needed for every case, but yeah. So moving on to the next slide. All right, the neurologist. I'm guessing that most folks here are probably partnered with a neurologist. And most folks, I imagine some might even be with a movement disorder specialist. So the neurologist is going to be, I think, like the point person for your care team. They will oftentimes be part of the diagnostic team, the one that maybe gives the diagnosis. They will be the ones to be the point person for medications, making those adjustments. And they also end up being oftentimes a referral source for other needs, such as physical therapy, home health, durable medical equipment, urology, all of those things. So I also want to point out that for many folks, depending on where you are in the state, there's not always easy access to a movement disorder clinic. There is a number throughout the state, but sometimes that's just not feasible for driving distances and mobility and other things. And that is great. That is okay if you are seeing a neurologist. They are absolutely able to treat Parkinson's disease. A movement disorder specialist can have advantages in some ways because they do extra training specifically on movement disorders. This is, I like to say when I'm meeting with families that are newly diagnosed with Parkinson's and they're coming to the clinic that I work at, the doctors they're seeing here, they spend Monday through Friday, 8:30 to 4:30, pretty much dealing with Parkinson's every single day. So they've honed their craft. This is their main focus. So sometimes that can be an advantage. They are oftentimes knowing new medications that are coming on to the market. They're up to date on research and what types of trends are being seen in diagnostics and that type of thing. So putting a little push out there for movement disorder specialists, but again, a neurologist can absolutely treat this. So they are at the center. I put just a quick little, another little cartoon here. As explained, Parkinson's disease is a depletion of dopamine in the brain. But before you fill up that space with lots of negative thoughts, let's discuss your treatment options. I just thought it was a quick, cute little giggle there for you. Let's see, just double checking my notes really quickly. Okay. I think the next primary person in the list of care team would be your primary care physician. Yes, the specialist, the neurologist, the the movement disorder specialist, yes, they're going to take care of the Parkinson's disease treatment, the bulk of it. But oftentimes, especially if there are other possibly related, but other diseases or other things going on medically, your primary care physician is definitely there for your own well-being, for your own overall health. Oftentimes they can kind of complement some of the things that the neurologist is doing. So they also do oftentimes provide referrals for other specialists as well. So you definitely want to have a primary care involved in your care team as well. All right. So the social worker. This is my role, and I probably have the most to say about this area, only in that I live it Monday through Friday. And I actually get this question a lot when I'm meeting folks new to Parkinson's and new to coming to a movement disorders clinic. They say, what does a social worker do on the team? And I like to think of social workers as oftentimes the kind of catch-all problem solver. Yes, we have a clinical license, but obviously we're not prescribing medications. But I think the social work can be the finding the resource, finding the needle in the haystack, finding the solution to a problem, or maybe reworking a problem so that it's less impactful. So some of the things that I do on the short list here, education and resource counseling. What this really comes down to is sharing with families about Parkinson's disease progression, symptoms, where to find reliable information to learn more about it on their own, at their own pace. Resource counseling being, what's out there in the community? Is there Meals on Wheels in your area? Is there county transportation for folks over the age of 60? Is there, I don't know, visiting dogs, like all sorts of questions I get. And then other times there are more questions that are focused on benefits. So if someone is still working or in the process of retiring, I am oftentimes talking with folks about short-term, long-term disability through employers, or even Social Security disability. While I can't apply for someone, I can absolutely start that conversation, point them in the right direction, get them connected with HR, and then help support them as they go through that paperwork process. To some extent, I do talk a little bit about planning for long-term care in the future. If someone feels like that might be something that they would consider or might need in the future, like assisted living or skilled nursing, sometimes we'll talk about planning way in the future for how to protect your assets. And that's kind of where that estate planner and lawyer come in as part of the care team too. Um, Additionally, I provide, and most social workers can do this, provide supportive counseling. In my clinic, I can see folks for individual therapy. I can see care partners as well. Oftentimes with uh, Parkinson's, there is grief maybe when there's a new diagnosis. But there can also be, just as part and parcel of the symptoms, anxiety and depression. So I do see folks through the lens of a movement disorder for individual supportive therapy. Also, and as I mentioned earlier, I can see caregivers or care partners as well. And to those folks watching, I'm sure if there are folks out there that have are the care partner, there is joy in that. There are challenges, there are stress, and then there's love. There's so many things wrapped up in that. So yes, the patient is the very center of our focus, but I have to say that the care partners are equally as important in success at home. Really supporting them as well is very important. And then one of the other things that social workers can possibly do, I myself am just getting back from my own, I have a support group that I facilitate the second Wednesday of the month. So I just got back about an hour ago from that group. So that's another thing that I offer, many social workers do, is support groups, either virtual, kind of what we're doing today, or even in person now that COVID is not keeping us from that. And I apologize. I've been told I talk fast. It gets worse when I'm nervous. So that's kind of the gist of what a social worker can do. I'm actually just going to go ahead and talk about this as well. Not every movement disorder clinic will have a social worker, and not every neurology office. In fact, most neurology offices usually do not have a social worker. And I was thinking about, how folks that are maybe seeking medical treatment that way at like a regular neurologist office, like how they could be connected to a social worker if they were looking for some of these services. So I was thinking about a couple of different resources just to put out there. One is if you ever have to have help in the home, like home health, it's usually covered by Medicare. Home health usually has a team. The most common things we think about with home health is like physical and occupational therapy, maybe some nursing, but oftentimes there is a social worker that is part of that team, and that can be requested. The patient itself can actually say, hey, I would really like to know what some of the resources are. So that's one way. It might not be a long-term relationship with that social worker. It's usually time limited to a couple months, couple weeks. The other vein you could go through is to really look for like a care manager in the community. There are agencies out there that provide like geriatric care management, and oftentimes they are social workers. And oftentimes there's a good bit of overlap, but also knowledge about movement disorders. Parkinson's diagnostic numbers are on the rise, so it's becoming more common. And then another avenue of seeking out social work support or resource counseling would be through some of our awesome foundations, either state-based or even national. I know PAC has a drop-down menu on their website with all sorts of resources, and you can also give them a call. I call them all the time for additional questions and that type of thing. So I just wanted to put that out there, just trying to think through, if you don't have a social worker available at the doctor's office that you are seen at, there might be some other ways. All right, moving on to my other favorite folks that are a part of a care team, and I kind of lump them all together. This is not throwing shade to any of them. They're all wonderful in their own way, but physical, occupational, and speech therapy, they are my champions. They are also the problem solvers of the world. So when we talk about a physical therapist. They oftentimes are helping with either durable medical equipment, like getting a specific type of walker or even wheelchair. But more than that, they really do help with our bigger movements. So mobility, balance, strength training, range of motion. Some of you might have heard of big and loud therapy. Those are specific therapies for Parkinson's. So PT would be doing big therapy, making those movements large. Sometimes our steps and movements become smaller and smaller with Parkinson's. So I haven't met a physical or occupational therapist that I haven't liked. They've all, in all of my different positions and different agencies and different healthcare systems I worked with, by and large, I've really enjoyed these teams. Occupational therapy, they are the problem solvers for the things that you need to do every single day. The occupation of living. So if it's getting dressed, if it's tying shoes, if it's showering, using a keyboard, figuring out how to get in and out of the car, training the caregiver to help transfer someone who maybe has a little bit less mobility these days. Yeah, they are the home modifiers, the ones that will look at a room and say, if you moved this couch over here and got rid of the rug, and I'm going to suggest this grab bar, or this, they come up with ways of living with symptoms, but also living successfully, hoping to make some of those symptoms less impactful. Speech therapy. This again goes back to the loud therapy that I had mentioned, but beyond that as well. That's more about communication and swallowing. There can be therapies that help to project your voice. I'm knowing a little bit less about speech in terms of work with Parkinson's, but there's also a piece of cognition with speech therapy. So sometimes they're looking for triggers and reminders and ways of going about your everyday life. Right now, I'm having problems with word finding, so they can do exercises with that type of thing, helping to find words. So it's pretty cool. I do really enjoy all of these folks. And I'll just put this out there since it's also similar to when I was talking about how do you find a social worker if one's not offered with your neurologist office. So there are lots of great opportunities. I actually think it's probably easier to find PT, OT, and speech out in the community for folks that have Parkinson's. So home health contains all of these folks. If you are referred to outpatient physical and occupational therapy, those disciplines are usually contained. Like I think Carolina's Rehab, there's just lots out there. Physical we were talking about today. So the PT and OT are out there in outpatient very easily. Speech might have to be a referral from your primary care, your neurologist, but that is also accessible. All right, moving on to one that maybe isn't as mentioned as often, but a psychiatrist or neuropsychiatrist. And as I mentioned earlier, as a social worker, sometimes I see people for individual therapy, kind of supporting them through symptoms of depression, anxiety, grief, all of those things. Depression and anxiety can be on the list of symptoms that are associated with Parkinson's. So naturally, a psychiatrist would be someone who can really help to fine tune some of the medications that can help to control mood and anxiety. So most common you would hear is like an SSRI or a SNRI. Those are the medications that are often prescribed. So having a psychiatrist, yes, your neurologist or primary care oftentimes are able to provide these medications. But if you're having some symptoms that are treatment resistant, so then you try a couple of medications, there's a lot of side effects, the symptoms aren't really going away. Oftentimes, a referral to neuropsychiatry or psychiatrist would be helpful here. I did want to say that there is a difference between psychiatry and neuropsychiatry, and I'm going to read my notes because I don't have it memorized. But generally speaking, a psychiatrist is more focused on behavior, mood, affect, thoughts. And neuropsychiatry, they have a little bit more training specifically with perception, memory, alertness, attention, language, speech, intelligence, cognition, and motivation. Way to talk about motivation would also be like the concept of apathy, which can also happen with quite a number of movement disorders. So I feel like the neuropsychiatry can drill down a little bit further. Also, sometimes in later stage Parkinson's, there can be some hallucinations or a little bit of dementia pieces or a change in cognition. So that's where the neuropsychiatry can be a little more drilled down focused. Again, you don't absolutely need to have either of these. It just really depends on what you're experiencing. All right, so I think this is actually kind of close to the end of my list here, but the last one I touched on this briefly earlier. This is a nice to have, not a need to have necessarily, but I did include an estate planning attorney. I have helped many families throughout the last 10 to 12 years that I'm working specifically in movement disorders. And I've helped them to look for and try to start to plan for what long-term care will look like for them. Oftentimes, folks would prefer to stay in their home, and that is completely understandable. And people tend to do really well being in their familiar space. The reality is sometimes folks do need to go into assisted living, memory care, or skilled nursing, so facilities in the community. The reality is that Medicare does not cover the cost of long-term care. And oftentimes people will need to apply for Medicaid to cover the cost of skilled nursing. And there's a 5-year look back. So if you have too much money or have too many assets, it becomes a little bit more complicated. And sometimes you end up having to spend down some of your assets. So this is where an estate planning attorney can help protect your wealth, protect your assets, but it has to have some forethought because of that 5-year look back. Again, this could be a whole webinar on its own, and I'm not an attorney, but I do like to recommend or just float the idea early on that, regardless of if it's Parkinson's, there's many other ailments and diseases and diagnoses that could cause someone to really have to think through, what does my care look like in the future, or what does the care for my loved one look like? So I do oftentimes point people in the direction of an estate planning attorney. I have a couple that I've worked with throughout the state that have been fantastic. Oftentimes, if I don't have someone to recommend in a specific area, to some extent, I do use All About Seniors magazine because they have a listing in there too. So, so that's kind of towards the end of my presentation. Wow, I did take 30 minutes. Never thought I'd get there. There are other folks that can be involved. Like I said, this is not an exhaustive list. Sometimes they can be like one that I teetered on going back and forth if I'd include would be a dietitian, like a registered dietitian. That's someone that could absolutely help with constipation and making sure that people are getting the right nutrition. Just on the whole, though, they're not often necessarily included in in a care team. So yes, they're out there. The clinic that I work at has a registered dietitian, and she's amazing. So that would be another additional care team person. And then the other piece that I didn't mention, put a slide in there, was a movement disorders nurse or nurse practitioner. We have a team of nurses here that if you've ever sent a portal message, you've probably talked with one of them. They help to triage and gather information and kind of keep the clinic flowing and support our doctors and our patients too. So they are part of the team, but they're kind of almost a little bit behind the scenes. So my apologies to all movement disorder nurses. I was not trying to slight. So, yeah, I'm happy to take questions, clarify things that I might have rushed over, whatever might be helpful. And questions, comments.
And at this time, if you have any questions, feel free to raise your hand if you'd like to ask your question live, or you could use the Q&A box if you still prefer to type it out.
I know I talk fast.
And while we wait for questions to come in, Katherine mentioned an estate planning attorney. So I think sometime last year, we did have an Essentials of Wealth Management webinar series, and our fourth installment of that series was with a elder law attorney, and she went over estate planning. That is available on our YouTube page if you all would like to tune into that. And we also have another virtual support group session that is on our YouTube page with life care planning with another elder law attorney.
Perfect.
It looks like we do have a question. And the question is, what is the advantage of having both a movement specialist and a neurologist on the care team?
So the scenarios where I've seen that happen, if there are other neurological issues going on outside of just Parkinson's, which can happen, that's actually can happen pretty often, then I can see then a general neurologist treating some of the other pieces, and then having a movement disorder specialist treat the Parkinson's. I've also seen where if someone is living in a location where they don't really have access to a movement disorder specialist, they will have a local neurologist that communicates with and then also, they'll have a local neurologist, and then they'll also have a movement disorder specialist. So they'll either come here to Duke or Wake Forest or wherever they're going. But because of the distance, it's so far, they want someone kind of local to help manage as well. So I've seen a neurologist and a movement disorder specialist team up together. They can be from different healthcare organizations as well. I specifically have seen this in like Eastern North Carolina, where there's maybe a little bit of more of a rural population area. So that's something I've seen. I don't know. I guess the bottom line is if you have a neurologist and a movement care specialist, movement disorder specialist, I apologize, both trying to treat Parkinson's, it's kind of at the same time without communication, that's not going to work. Does that kind of make sense? Like, I guess you really want one neurologist, one practitioner kind of treating and guiding the treatment for Parkinson's and then bringing in other folks. So I don't know that you would have both at the same time, except for those couple scenarios that I talked about. To whoever asked the question, does that feel like that answered it, or did I maybe not get quite the flavor of what you were asking?
And feel free to comment back in the Q&A box if that makes sense, or if you need more clarification. And just wait to see if they let us know before we move on. Okay, yes, that answers the question. Thank you.
Sure.
Mhm.
Sure.
Um, our next question here is, do you need to be referred to the neuropsychologist?
The short answer is yes. um, Oftentimes, if the specialist, like a movement disorder specialist or the neuropsychiatrist, the one that I know the best, his name is Dr. Barkenbus. It might be a familiar name to most folks. It is a referral based, but your primary care or your neurologist or your movement disorder specialist should be able to provide that referral. Um, I will say, I do understand that there is a little bit of a wait to see most providers in Charlotte these days, unfortunately. But I can tell you that we are working on it on our end. Hope trying to make sure that folks can get in to be seen as easily as possible, as quickly as possible.
Thank you. And then the next question is, where are you based? And for the person who asked the question, I typed in the name of the clinic and the address, and I'm going to send that back to you.
Perfect. But I guess I did when I was talking, I didn't necessarily when I was introducing myself, I was focusing more on where I've worked in social work. But so thank you for sharing that information, Kiana. But I'm with the Atrium Health. Uh, we used to be called the Neuroscience Institute. Now we're Atrium Health Neurology Specialty Care. And our building is 1010 Edge Hill Road North. That's in Charlotte. And we're just, I don't know, maybe 2 blocks from CMC Main. So we're kind of in Myers Park, but almost the city center. And I can tell you, if it's helpful, I can tell you really briefly what my clinic that I work with, what we look like, and kind of I mentioned it a little bit, but um, my clinic is composed of 2 movement disorder specialists, Dr. Englert and Dr. Fleming, and then we also have myself, social work. So sometimes I'll pop into patient rooms after they've seen the doctor if there's resource questions or disability questions. And then we also have physical, occupational, speech, and a dietitian uh, as a support team also. These folks do not see every single patient. A lot of times our physical and occupational therapist, they're there more for consults, like, hey, I'm having this challenge. Can I talk to the physical therapist, or can I schedule some time with them, or a phone call or a virtual visit to kind of work through what would make sense for me? When you think about traditional physical and occupational therapy, where you're going for weeks on end, a couple of times a week, that's not quite the service that we provide in the clinic, but they are there to help start a plan of care or ideas or directions. Um, our occupational therapist, I refer people to her all the time, especially when somebody's saying, it's been really challenging doing XYZ at home. So if it's getting from the car to inside the house to my desk or whatever, sometimes she can talk people through about gadgets, adjustments in the house, strategies for breaking the tasks up into smaller tasks, like that type of thing. And then we also have 2 awesome nurses that will, like I said earlier, will help to triage information when you use the portal. And then we also have a research team. They're here for the entire clinic, not just me and our movement disorders program, but they are able to. Well, I guess we are participating in a number of clinical trials, and there is one specific for Parkinson's that's just getting restarted here. So we do have a research team. Now, they're part of the team, they're kind of also their own separate little department. Um, I think I think I got everybody. If I didn't, I feel like the Academy Awards, I'm forgetting to thank someone. If there's somebody else part of the team that I forgot, but yeah, that was long-winded. I apologize.
No, thank you for explaining. So we have a few more things here in the Q&A box. So someone just commented that they tied all of the medical systems together to be viewed by anyone, and that included their sons as well. And it helps a lot. And then the next two, I think it might have been asked by the same person, but the question is, are there providers in Raleigh, Wake Forest area, and with Duke? Um, I'm not quite sure what type of providers you're looking for. If you could be just a little bit more specific there, so she can help answer the question. But I think you're talking about neurologists. If it is the second question and the first question go together. So sometimes I feel like I'm just a number with my neurologist. What would be the best way to perhaps seek out another neurologist? And I'm in the Raleigh-Durham area.
Gotcha. Um, So I have such a special place in my heart for the team at Duke. They are, I believe, a center of excellence for movement disorder for Parkinson's. Dr. Scott, I worked with him in my past life with a different disease, with Huntington's disease. So I will say so Duke is in Durham. Their movement disorders team and clinic is super accessible in the sense that it's separate from the big hospital. It's its own freestanding building. I'm doing a promo for them right now. They have got an interdisciplinary team. So like almost everybody I just talked about, they, I think you do need a referral. Usually to that type of thing, you'll need a referral. So maybe your primary care, if you feel awkward talking to if you're dissatisfied and feeling awkward, asking your current neurologist for a referral to a different one, that's where the primary care can kind of maybe help out there. I have only good things to say about almost every single movement disorder clinic I've interacted with over my social work lifetime. But I will say the Duke folks have PT, OT, speech. They even have, I think you guys had there was an occupational therapy as a guest speaker a couple of months ago, and they were talking about driving. So they've got a whole host of services there with a number of neurologists. I don't know, I think there was like 4 or 5 listed. I'm not quite sure if all of them are practicing for Parkinson's or if some of them specialize in other movement disorders. But so I think Duke is an option. I think there's even a movement disorders center now in Chapel Hill with UNC.
Yes.
Yeah, so actually Kiana might be a great resource for finding specialists in your area if that's what you're looking for.
Yes, and feel free to reach out to us afterwards. I can actually put my email address in the chat box for anyone who has questions afterwards. That way we can find a more specific answer for you, because it might take a little bit of research. Here, and I'll do that now while we wait for any other questions to come through. And again, feel free if you have any questions and you don't feel like typing it out, you can raise your hand and you can ask your question live. And I'm just typing out my email address for everyone.
I will say, just to maybe flesh out or I guess maybe touch on one of the comments earlier about feeling like just a number to the practitioner. I think we've all, if you've experienced, if you've had the unfortunate need to go to a number of specialists or seek medical care over your lifetime, I feel like at some point we're probably going to feel like that. I know I have once or twice. So one thing I can say, I can't speak to the specific circumstances of that situation. But in some ways, I feel like we have limited time, no matter if it's our primary care, if it's a neurology. Oftentimes, I do feel like we have just maybe 7 to 15 minutes of face-to-face time with our doctors. So one thing I've tried to do to make the most of that, again, not really completely impacting and feeling like just a cog in the wheel or a number, but is to come prepared with notes on any specific questions I have about my symptoms, my changes. If a medication doesn't feel as effective, I try to come to my doctor's appointments with some bullet point notes so that I make the most of that 7 to 10 minutes to 15 to whatever it is of face-to-face time.
And I agree, that is very helpful. I do that myself. Okay, well, do we have any other questions before we wrap up here today? Let me double check our chat box and Q&A box.
Stop sharing my screen.
Okay, well, if there are no other questions, we will go ahead and wrap up today. I would like to thank you all for joining us today, and be on the lookout for more Parkinson's awareness programs this month. We will have some more things coming out later this month, so just be on the lookout for those emails and social media posts if you follow us. Katherine, I'd like to thank you for taking the time out of your schedule and speaking to everyone today. And again, to you all, if you have any questions, feel free to reach out to us and we can help connect you with whatever resources you may need.
Thanks for having me.
Yeah, thank you. All right, well, bye everyone. I hope you enjoy the rest of your Wednesday.
All right. Take care.